So my name is Ben Smith. A little bit about my background and my history. My professional career, I started at a community health system in the Midwest, not for profit. I spent 13 years there in various roles, but primarily as an IT architect for clinical systems. From there, I went to Microsoft. I was at Microsoft for 20 years in various roles, but specifically focused on the healthcare vertical. My primary roles right before I left Microsoft was really focusing around agentic AI in healthcare, as well as helping organizations build AI centers of excellence. And so from there, and that goes across, I would say, the spectrum of no code, low code, and pro code. And we may get into that a little bit as well when we talk about the different kinds of agents. I recently joined SailPoint, and the reason why I made the move when I did, it was really an opportunity to look at most of the organizations were going to more of a multi-cloud approach for agents, because agents are coming through applications, they're coming from different platforms. And it really allowed me to pursue my passions around security, healthcare, and agentic AI.
Yeah, what's really cool about SailPoint is that they're so prescient in the implementation of zero trust, identity and access management, and really, it sounds so dry and not fun to talk about and not very sexy, but you can't implement any of this. Like if you're being true to proper cybersecurity hygiene, you can't implement any of this without proper identity and access management. And it's funny that so I've spent a lot of time in IAM for many years, and I never thought it would become this important to everything. We always thought that it was important for login and access control, et cetera. But now, even with no humans, if you don't have a really, really good IAM, you're in big trouble. So yeah, quick introductions, good.
Sure. My name is Nayan Patel. I'm a former hospital CIO. I've worked in large healthcare systems, medium, as well as small independent rural hospital systems. So a little bit of experience in a lot of places. I think, what we're going to end up talking about today is going from an area where we focused on securing the fortress now to securing the frontier. I think it's, the fortress in the hospitals, it's all about protecting that data, keeping it in-house and whatnot. And now with my new role, I am moving into remote patient monitoring. So we're looking at more about clinical workflows and where's the value add, but it's that patient data that's flowing everywhere, right? And it needs to go outside the hospital. It really does. It goes so many different places. So that's a little bit about me, and we'll hand it off to the next.
Yeah, and so he said former CIO, but anytime you want to blame anyone about what you don't like about your CIO, he's a representative and he'll take.
It stands for career is over.
Indeed. With that.
Good afternoon, everyone. Almost good afternoon. My name is Jit Barmecha. I'm a physician, practicing physician part-time, and I'm System Vice President and Chief Information and Digital Strategy Officer. And my career is not over, so at least last time when I checked my mortgage and other things. Full disclosure, I'm not a CISO, which is the new, or it has already emerged now, is the Chief Information Security Officer. I do have one, but everything what I do for healthcare delivery, I look at the lens of patient safety and infection control. So my role here will be to make it very, very simple. Doesn't matter if these are agentic AI or humans, we just have to follow the same principles. And also infection prevention, how we can wash hands and prevent infection.
Love it. Yeah, it's a good way to think about cybersecurity. So let's start with just the general topic of zero trust. If you want to set the stage for a minute and say, what did zero trust mean 5 years ago versus what does zero trust mean today? It's the same general technology, but things have changed quite a bit. In specifically, we used to expand first from human zero trust. Then we added devices for your zero trust. And now we've got these agents and these LLMs, et cetera. So set the stage for us, and where are we with zero trust, and what do you see as the big glaring gaps and holes that institutions are not filling easily yet?
Sure. So interestingly enough, so zero trust as a principle sounds simple. However, when you think about point of care, it's one of the most complex principles to apply. And you think about zero trust, and what I'm saying is that it can't be done. I think what you really need to do is think about how it can be accomplished. So you brought up the point about human versus non-identity. So one of the focuses that I specifically have at SailPoint is around non-human identities as well as data access security. So you bring up machine service accounts, agents, and then the data that those access. So, we talk about principles like just-in-time access or privileged access or PAM, right? Privileged access management, all those components of zero trust. But what I propose around zero trust is more around a concept that we call adaptive identity, meaning that you can have the same user accessing the same data, but it depends on the context in which they're accessing that data. So for example, if you have a physician and you pattern their behavior and 80% of their time is spent between their practice and a single site, you may just challenge them with maybe a single biometric authentication or a PIN on a known device. However, you see that physician coming in from another country at a different time that they're normally working on a device that's not a corporate-owned device. Well, now you may move to more of a multi-factor authentication, push a challenge to their mobile device. And so that's the kind of idea of adaptive, I would say more of an adaptive identity to basically establish the ideas of zero trust. And I think that's from a human perspective, but now when you think about it more from an agentic or a machine identity perspective, and I think it was brought up in the first session, one of the biggest challenges we have with non-human identities is just visibility. A lot of organizations may not know what machine identities they have. And I know, way back in my period of working as an IT architect, we created machine identities, service accounts for systems, 30 years ago. Those systems have long been replaced. What's happened to those identities and all that access? Most likely they're still running. And if you had access to those, what do you have access to? And so I think the world that we're coming into, and I don't want to scare anyone, to your point earlier, is that.
Oh, no, we were hoping you would
Yeah.
scare. Don't
I mean, what we're trying to do is what is that visibility? So as we know, we need to look back at like what machine identities are existing in the environment. Are they logging in? What do they have access to? What are they doing? How do we audit them? And then on top of that, as agents continue to get introduced, and I always think it's interesting when you talk about agentic AI, and it's also come up in other sessions, is agentic AI doesn't really come from IT. IT doesn't do agentic AI for the purpose of doing agentic AI. When we talk about identity and access management with humans, that was something that was a requirement, and IT needed to do that. And so you had the identity and access management, the identity governance teams. But the reason for agentic AI is coming from lines of business. They're coming from operational units because they're trying to increase revenue, improve patient care, decrease costs, and all these different things. IT security is trying to adapt and support that. And I think the only way really to kind of address that is back to my point about establishing an AI steering committee or center of excellence with a cross-functional group from different areas of the business to come to a concise, centralized idea of how they want to move forward.
Yeah, so if you could add on a little bit, the idea of guardrails, we talk about it a lot, but mostly it's poppycock. Nobody has real guardrails. We all talk about it. We want it. Because guardrails have to start with, you have to understand what you're trying to accomplish, which most of us don't know. Then you have to establish the policies that go along with those guardrails. And then you start adding on, guardrails are hard, right? It's not that they're not things that we should want. They're just really, really hard. So when you guys think about identity and access management, how much of that plus zero trust is supposed to feed these guardrails? Or do you guys kind of feel like guardrails are business problem and that you're more on the IT infrastructure side?
I think it's a paradigm perspective. So I think guardrails have been around for a really, really long time. And we talked about machine identities and devices. Let's just take like DICOM devices or modalities within the environment. They've been talking to the PAC systems for a really long time. And so you'll create guardrails, and we call those like either quarantine networks or we'll build access control lists from a network perspective, controlling what can talk to what. And again, those are guardrails. Those aren't business enablers. They're risk mitigation functions. And they require maintenance, knowledge. People come and leave the organization. Why were they built? Were they well documented? It's not a business enabler. Guardrails aren't business enablers. They're a risk mitigation factor. And what we want to do is look at it more from the perspective of how are we enabling the business and improving the ability to deliver care as opposed to just setting guardrails up for risk mitigation. I believe it's a hybrid. But I think if you can focus more on the adaptive identity side for non-human identities and data access security and being able to map that out in a security graph, then you won't require the maintenance of so many guardrails.
Yeah, and one thing to do, definitely check out the SailPoint guys outside, because they've got really good starter documents and procedures and things like that to say, okay, how do you start thinking about this kind of stuff? So if your organization is looking for guidance, it's a great place to go. Let's talk a little bit about the care anywhere, of course, with RPM and all the things that are connected to patients. How much of what you're talking about is going to be possible with agentic AI if the zero trust and cybersecurity policies inside an organization have not already been done? Do you have to wait for all of that, or do you simultaneously do both? What are you recommending?
First of all, he covered quite a bit there, and I think a hybrid model, just like you said. I think you're not going to be able to do one or the other. It's going to be some mix of
But
everything.
don't wait.
Yeah,
So something is perfect in your cybersecurity.
well, you have to put frameworks together. You're going to rely upon, and from a hospital CIO perspective, I'll say we relied heavily upon third parties because we're not in the business of technology, theoretically, right? And that was one of the biggest challenges we had, right? Is do we want to start hiring a bunch of technical people and build out everything when you have partners who can take care of things, including a SOC as an example. And the smaller organization you are, it's great. Let a third party handle these things. Using, SailPoint as an example. We used that when we were at Baptist. So you try to implement some of this, putting these guardrails. And I think one of the things that I would say from a workflow perspective is passive authentication. The examples you gave of if a physician is in the facility, he's on a managed device, he or she's on a managed device, and they're accessing information in real time. They don't have time for multi-factor authentication. There's a code blue happening somewhere. Well, they're in the facility. Let it authenticate automatically. They have a badge on them. It's got RFID or whatever mechanism, Wi-Fi authentication can be put in place. But if they're a physician who is at Starbucks just checking in, that will require the MFA. But so how do you do that passive authentication? And there's probably multiple methods that can be done. You still need to put in the guardrails of what that person at that moment in the context they can access at that time. And that's hard to do because it goes back to some of the things that we talked about yesterday, which was around process. We don't go through and analyze the security side of who has access to what. And a lot of the hospital leaders in the technical side, I don't think we get involved in the business enough to really understand what business-driven limitations we need to put in place from the physicians or any other clinician who has access to what. And I think there's a lot of challenges there that we have. So you rely on putting a framework together and then just looking at it every year, because it changes all the time. I don't think there's a one answer, and we're going to just be trying to figure that out as we go. So when we talk about agentic AI and agents, I think we'll eventually get to it, is agents are like employees. They really are, right? I mean, and I think we need to think about treating them like employees. And
So dwell on that a bit. What would you change in order to treat agents like employees?
so it depends on where you are in your journey. And I think one of the challenges everyone's going to have is every agent that's deployed needs to have a manager or owner, because somebody's responsible for that agent. If something goes wrong with it, when does it, and evaluating what it does or does not have access to. And this is, I think, in the last session we just got off of, we need AI agents to monitor all this because humans can't monitor in that manner, but somebody has to own a big portion of these agents from a business standpoint. So who has access to what? And then also, if something goes wrong and then they need to update the agent or at some point terminate it, you got to treat it like an employee. And I think as time goes, we've had RPA forever, but agents are going to grow. And it's going to become difficult to manage these, but each agent has to be identified as with an owner and a manager, and then periodically reviewed every year. Almost give it a performance review, right?
So the IT department is now the HR for agents. That's how to get.
So it's going to make a real comment.
Yeah.
So what you said was really important because there is no HR for agents.
Yeah.
Agents are coming from a lot of different authoritative sources. When you add human identities, you're provisioning entitlements based off of known sources. They're coming from HR, educational systems if you have students. But with an agents, they could be coming from multiple platforms, multiple systems. You don't know where they're coming from. But you made a really good point, is that what you really want to do is be able to apply the same sort of controls that you have for human identities to agents, because they, in many cases, they have more entitlements to do their job than any of the humans.
And they can do faster harm.
You just think about it from a human perspective. Humans have roles, and the entitlements are built associated with those roles. So based on your role in the organization, a physician, a nurse, a PT, whatever it may be, you have access to certain data and certain systems. Agents are usually cross-functional, meaning they're going across applications to do very specific functions to solve very specific problems. And for them to do that, they need to have advanced entitlement. And then so it gets back to the point, and you made another thing about tying a human to it. Because right now, even machine identities, those service accounts from days of old, what humans tied to it, what succession planning is allowed. So if someone leads the organization, then who then becomes accountable for that? Exactly. If that person leaves, who becomes accountable for it? And if everybody leaves the organization, at least there should be a stop point or a kill chain in that, meaning that the last person to leave, their manager now becomes. And then they have to figure out a new set of succession planning. I talk to a lot of organizations right now. None of that's being planned or even thought about.
Yeah, so the way that that gets planned is that if you had the kill chain for the automatic, it's like what we do in app rationalization is, if you don't know something's being used or not, turn it off and see who complains, right? If you don't hear somebody complaining, you know it ain't being used.
Several times.
So yeah, Jess, please jump in.
Let me simplify a little bit. I
Yeah,
think this
that's
is
why you're here.
Yeah, this is going like a science fiction stories and all. So I agree with, I'm not going to be redundant by saying what Ben and Naman has said, Nayan has said. I call them creatures, not agents, number one. They can
I
be
love
good
it.
creatures, they can be bad creatures. As long as they are human assisted creatures, I'm all for it.
Oh, okay.
Once it gets to autonomous, then it is very dangerous. That is number one. Number two, at least from my perspective, as long as I am at my health system, which I know the capabilities because I look into the mirror every single morning, I don't think we are in the business of developing tools or creatures. We will be looking, whether it is Epic or Oracle or whatever applications you are using, the creatures will come from those applications, number one. Number two, in terms of zero trust, I think it will go beyond zero trust, in my opinion, because there are so many different applications, devices, data, IoT devices. So it cannot be one size fits all. So it has to be a little bit beyond. And
And in
lastly,
your mind, what does beyond mean for zero trust? Zero trust meant that you're not trusting anybody. You can't go to minus trust.
yeah,
Right?
see, zero trust is for something which is not dynamic. You know, it's like if you look at the device, it is just sitting there. But agentic AI or those creatures will have so much dynamic function. You have to track them, what exactly they are doing based on the role. You have to be very, very specific about the governance. And whether it is an HR department within IT, so be it. We have to have a catalog for all those agents. And be very careful about what these task has been done by these agents, and hopefully they are not going to do cross-functional tasks as much as making sure the integrity of whatever the infrastructure or the database is there. And finally, there has to be some accountability. If the business owners is requesting for certain type of creatures, they will have to have a very strict guardrails what system they are going to task whatever they're going to perform. I think the way NIST framework is, we are just reading it. We have not deployed it, but we are very close. Maybe
New NIST agent AI framework.
AI framework, correct. So maybe they will have certain codes or certain digits. They will have beyond 2 or 3 authentication, not only one, which is your 365 and then duo. Maybe there will be something else on that particular role and that specific task. I think that is the framework which we are all reading about it and we are planning. But again, from my perspective or our perspective, it will be application-based agentic AI because they actually know how they have built those creatures, right? I think those are easy. I think the human is more scary for me. because we can do so many things. Forget about the role. Once you're in the hospital, you have access to so much data you can do. I mean, I don't want to disclose too many things, but yes, I fear more about humans than human assisted agentic AI.
Great point. So what if would you say then, does any of your opinion change for things like, administrative AI creatures versus clinical AI creatures, or do you kind of like bundle them together?
But again, they will be localized in those applications. If I have an ERP agentic AI, they are not going to do the PHI or my clinical intervention of treating asthma or something. So those agentic AI will be very, very specific, very much role based as we are. What they call it as a role based. Maybe they will have some attributable risk based roles for them as well at
Nice.
some point. Yeah.
So remember, if you guys have any questions, pop your hand up. Otherwise, we'll continue with the panelists here. So yeah, go ahead.
Yeah, I was just going to add on to something Ben had said. I think most healthcare organizations don't have an idea of what agents are in their environment, because a lot of them go through the applications they have, right? And they're running in the background. And I'll be the first to tell you that we kind of are, and we're in the same space. We're in the remote patient monitoring now, and we're going to be gathering data and sending it to an EMR, making it more efficient however we can. And we're going to be trying to put agents in our own environment to do data processing quicker, faster, better, right? But how much of this is going to then be told to each customer we have? Okay, here's what we're doing, what, when, and how. And it might be just like companies were 100 years ago. I don't think there was an HR department for every company 100 years ago, right? And now we're going to say, okay, AI agents have to be managed. So it might be 5 years, 10 years, whatever from now, that we're going to be looking at, okay, what's happening in this world of AI agents and how we monitor them and become part of our business.
Yeah.
Got a question back there.
Greg, yeah.
I just have a question related to this. Yeah, I think most organizations of any type, but in healthcare, we don't know what AI is in our systems because it's coming from the vendor and it's in the vendor system and the vendor system is in our system, right? So, I mean, how big a risk is that? How much should we be trying to go to every vendor and catalog how they're using AI? It seems like a unending effort if we go down that path. I mean, is it that important to know?
I think it is a very big risk, but I don't think we know how to handle the risk. I think that's part of the challenge we have right now.
Wouldn't it be very similar to the way that we handle data today? So for example, everybody comes in with a database, but we don't take an application and then not know what data they're tracking at what field level, how we secure them, how we access control them. So I think, Greg, your point is very valid. But and what I wanted to extend this, you guys can certainly answer his question as well, but maybe extend it to say, what work is happening outside? I know Jeet did a great job introducing NIST. There's a new NIST framework for AI. It mentions agents, but is not driven specifically for and by agents. There's the ISO 42001, which is attempting to kind of like put a framework around models and how compliance should be done for AI-based systems. Are you guys familiar with anything that people can take home and read about and understand what others are thinking about in terms of AI and agent-based cybersecurity compliance standards, et cetera, besides the one we just mentioned?
I think it starts with NIST AI framework. That's very simple language, and people like me can also understand. That would be the first. But just piggybacking on
Greg.
Oh, Greg, sorry. I think we have to look at all our contracts in 2026. What happened in 2025? These are all old. If number one, if any agentic AI in 2026 are being introduced, for example, if you're cloud-based, because what the vendor is doing, you don't know. They just say, oh, this is a patch or this is an upgrade. We need to have 2026, all brand new contract, making sure the definition of all these creatures and agentic AI is defined. And there has to be some balance, taking calculated risk and just follow them, just like your medication trials, phase 4 trials. Once the drug is given in the market, we have to do post phase 4 trials. So similarly, same concept. Once you introduce your agentic AI, I'm sorry? Correct.
Yeah.
Correct. And also
I think
ask
what he-
all the hard questions to the application or even the medical device, whatever we are procuring in 2026 or maybe last 2 quarters of 2025. You have to be very, very careful. Yeah.
I think what Jeet just said, maybe even step one could be you get legal and compliance involved to review all the contracts. Like, I think that might be a step one. I'm not saying that is, but that's a good step one.
So great. I'll just offer up what I've seen organizations do based on your question is that I know even within SailPoint as well as other Epic, Cerner, Meditech, they're all introducing agents and they start out as single agents doing very simple tasks. Well, to increase efficiency within the applications, they add multi-agents. So agents can call other agents within the application. And so how do you stay on top of that? Very, very hard. Like you said, you'll never get it done because it's always growing and changing. And so I've seen organizations do, and kind of going back to that idea of an AI center of excellence, one of the functions of AI centers of excellence is really around ethics and standards for AI and not exposing, risk, right, to your patient community, to your organization, and coming up with a standard way to evaluate that. So holding your vendors accountable for bringing agents in and making them accountable within their contracts to disclose any updates or agentic AI being used within their applications and giving you the opportunity to ask questions and for them to come in and validate your assumptions or your thoughts on what they're doing. I think if you don't do that, then you absorb some of the risk of having those applications run in your environment.
Yeah, so and I'll take your question in just a second, but one quick note that again, you guys could do a quick Frost note to clients for two quick topics. One is when the systems come in, is there an ontology coming with it? And once you have the ontology, then you have graphs that tell you who's connecting to what, where. This is well beyond your, entity relationships and other diagrams that we do in the database world. So in the AI world, if you don't have ontologies describing what business it is, and then the agents don't know which graphs they're touching, you've got big problems. And what I love about Greg's question is that there's no way. What is the standard language in a contract that tells you, here's my ontology for what I'm doing, and this is how agents go. And we may need, some outside research bodies and others to come in and tell us, this is how you communicate these kinds of topics. So that'd be great to see maybe Frost throwing something together, even as a discussion topic. Yes, please, question.
Hi. Yeah, I really love the analogy of looking at it like a treatment therapeutic in biotech because, you're constantly doing continuous improvement, reducing adverse events, mitigating risk, et cetera. So my question is twofold. Do we know internationally, ex-US, what other people are doing in terms of AI excellence? And then along those lines, is the US thinking about all these people in the room, but also in terms of defense and cybersecurity, is there a task force or working group to ensure that our health data in this country are protected? Because I can tell you that biotech will come to the table. They want to protect their data, and they're global organizations. So they're going to want to look at ex-US cybersecurity in addition to US cybersecurity.
Great. Any input from you guys, and then I'll comment.
Yeah, I'm happy to. So a lot of the work that I've done is in the pharma and med tech side of healthcare as well. A lot of cases of like AI implementation actually started there years ago. Because again, if you think about AI, it really came around research where a few people were using it to consume lots and analyze lots of data. And now it's become more democratized, right? Other people have access to the tools to do everyday things. Your point with biotech is, and you made a great point earlier when you're saying, do you ever really de-identify data? But biotech systems, they really want de-identified clinical data to actually improve their systems. You have to. It's the only way you can move forward. And so how do you do that in an ethical way that's also covered under regulation? And absolutely. So the interesting thing is that like it goes back to organizations and being able to release, like we used to have the whole idea of like health information exchanges and regulated information that you could actually change. It's de-identified. You could use it for research. And now you're in the point of where people monetize that and you're buying blocks of data to be able to do that research.
It's different. Every biotech company is different. They have different regulatory, different compliance, and different legal.
Absolutely.
They have a different interpretation of what regulatory means, compliance means.
Absolutely.
Well, that's where standards, all at the highest levels, exposure through NIST as an example. Eventually, everybody needs to try to follow a framework. I think that's the thing. It's the example of zero trust, right? I mean, we talk about what exactly is zero trust.
Guidelines.
One
build guidelines for all the different.
Yeah, one involvement of zero trust is you don't let anything touch your system until you approve it, right? Like websites. Like that's a hard way to do it, but that's a great way to do it. Others is it's the strive for perfection, right? Like trying to become the best tennis player in the world. You're going to practice, practice, practice. You're never going to be perfect. You're going to lose a lot of points, but you're going to work toward that. And that's the same thing with around the security framework is how do you block off as much as you can and to keep improving with time.
It sounds like you're the right people in the room and they're the right people in the room here, but it sounds like everybody's building the plane as they're flying it and it's building those guidelines and they're going to be constantly improved upon and changed.
So if I can add two more things, if it is IT infrastructure, agentic AI, obviously we will be looking towards the manufacturer, whether it is Microsoft or whosoever they are. Apart from adding or looking at your new contract, you have to ask hard questions to your providers. Why do you need this? I mean, I oversee clinical engineering. Every week, there is one vendor who comes and like show me shiny objects that we are AI powered. I don't understand what they mean by AI powered also, number one. Number two, all these professional organizations, when they have academic conferences, I mean, I know when was the cardiology conference because I get bombarded with emails. We need to implement this, we need to implement this. 2 weeks ago, there was a neurology conference. So somebody wants an AI-powered EEG bedside and all. So I get like secondhand information. So what we have done in our institution, we have created a very, very, I would call it about 12 to 14 questionnaire, what exactly they're looking for. And similar questions are for the vendors also. This is outside the contract. Contract are basically business terms and legal terms, but this is from the manufacturer. What exactly your creatures are going to do, how you're going to monitor, how you're going to do upgrade. So again, this is the, I mean, I think hopefully you'll get 60 to 80% of your answers to do the calculated risk. Again, it should be human assisted creatures, autonomous. I don't know. I have to read more about autonomous, how it's going to function.
Great point. Was there a question on this side?
There's a few on that side, yeah.
We'll go. Yeah, go ahead.
So quick question, when an agent makes a mistake, right, normally, how is accountability assigned? Is it assigned to like the vendor or the clinician, like the leadership team or the primary person that's using it?
Let me ask you, help me define, when you say an agent makes a mistake,
Right, so
agents can make lots of mistakes. It could be inappropriate access to data. It could be the wrong response.
So like, for example, if it's like a patient safety mistake, like a critical mistake or something that impacts revenue, how is accountability assigned? Is it the primary person that's using it at that moment or is it the vendors?
Well, at the moment, realistically, there is no accountability because in those particular circumstances, and just like Jeet is saying, most hospitals are not going to that level with full autonomy to let it make those kinds of mistakes with no humans in the middle. Fundamentally in healthcare, and it should not be this way, but it's just reality in America, is whoever holds the medical malpractice insurance is always going to get the blame because they're the only places where you can get money from. So it's not about right and wrong. This is just practicality, right? And so in the end, the accountability, we'd love for it to be in the proper places, in the leadership, et cetera. But licensed professionals with medical malpractice insurance will always get blamed because that's the only place you can get money out of, right? So that's a quick practical answer. We can dance around it and we can give you a lot of thought leadership stuff, but there is no accountability at the moment, and you know, problems are what they are today. There was another question, a young lady all the way back, yeah? And then there was another question. I've noted that here. Yeah, go ahead. We got about 5 minutes, so we had 2.5 questions. Yeah, go ahead.
I know that we are talking about AI literacy, awareness, governance, and we're touching all of these preventative measures that we should put over how we should put the contracts, how we should train the models. A lot of preventative measures on what the agent should be doing and how we can guardrail them. But are we thinking something on the proactive side of it? What if you've done all these guardrails, you have all these contracts, you have all these policies. What happens then? How are we monitoring that? Maybe having agents for agents.
No, it's a great question. And it's basically a systems problem in the sense of it goes back to visibility. So you're asking a question of one, who has access to the agent itself? So who can use the agent, right? That's just half the equation. The other question is, what data does the agent have access to? And unless you have a centralized control plane where you have human identities, non-human identities, and the data that it's accessing or tools that it's using, and being able to see that all in one picture and being able to go back and audit it and replay it and say, we know that something might have happened, how do we audit it? But then if you have that, then you can build a governance policy to say, if I know privileged access information or protected information is potentially exposed, alert me before something happens and someone uses the agent.
Yeah, yeah, that's exactly what I meant, because we do something similar for our data tools also, like behavioral health, substance abuse, all those type of data, and they're very restricted data assets. We do create like policies and stuff. We do put like systems in place where we get notifications, hey, X person had, but there's a manual auditing that happens on top of all of this. There's no way to automate a lot of that stuff. So I can only imagine what would the monitoring would look like for AI agents that are working at way faster level at the thought process that we can't even imagine. And there's a lot of AI awareness and literacy gap in the system, because you're seeing vendors who are highly technically trained and know what that agent can do. And then we have a system that has zero knowledge what AI is.
Yeah, I mean, one quick note, and I'll let you answer, is that to think about a deterministic auditing of a probabilistic system is insanity, right? It's just so you can have, like, the reason why you said it's difficult to do the auditing right now is because humans lack time, not because it's not possible to automate. So one thing you should start with immediately is to say, whatever you're doing in a manual fashion that you can't then automate, just start with automating whatever you could in a reasonably deterministic way. But and if you guys want, there's a whole bunch of articles that I've written around this idea of probabilistic versus deterministic. How do you categorize them? How do you work with them? The first thing all of you should do is push back when somebody says, I need deterministic behavior from a probabilistic system. You should just say, well, then you're crazy and I don't want to talk to you. Now, once they calm down a bit and say, okay, I'm willing to take some level of determinism from a probabilistic system, but I can't get full determinism, now you can have a conversation because it's the same person you're talking to in that case. And that's, so just establish the truths where you understand that probabilistic systems, we know between, all of us in this room are probabilistic. We're not deterministic. So we know how to deal with probabilistic systems. What we don't know is how to deal with probabilistic digital systems. And that's what we're all learning. And anybody who says they know how it works and knows what they're doing, just lying to you. And so you don't believe them anyway. But please jump in.
Yeah, so one of the things that I don't fail to mention is my role right now. I joined a contactless remote patient monitoring company. I'm Senior VP of Clinical Transformation and Digital Strategy. But the value that I can bring to this organization, and every vendor partner should be thinking about it too. So as a former CIO, I had to learn how to read contracts a lot from every vendor that we were looking at. And I didn't think I would be getting into compliance and legal issues, but whenever we had a new vendor come in, we had to kind of go through that. And one of the biggest things that every time we got hung up on was indemnification clause. Mm-hmm. Okay, that's where sort of the rubber meets the road type of thing. If something goes wrong, that's where you're going to kind of play the card against each other. And so all of us in this room probably need to get better educated on contracts and the legal side of it. That's where I think, it will come into play. And to your point earlier, contracts are rite of passage to really negotiate with any vendor partner we work with.
Yeah, I love Heat's idea of just revisiting all of them this year, and 2025 was a long time ago. Last question?
Just adding on to her comment is, I don't believe that if you are purchasing an agentic AI or creatures from Epic is going to work into your Oracle ERP environment. I don't think at this moment, because they have been tested very well. They have very limited scope of practice or work, and they are to some extent humanly supervised. If you want to play like Wild Wild West, maybe you need to contain those database or application at a research level and be keeping on a separate instance outside your network, number one. Number two, don't be in the production environment where your critical functions are happening, whether it is emails or patient care or CPOE or whatever those are. That would be my recommendation, especially for multi-agent, autonomous. Keep them in a different instance, different environment, and as much as possible away from the critical infrastructure, especially in the healthcare environment.
Yeah, and so we have one last question, but with a caveat that your whole lunch is right after this, so I want to make it really fast.
Be fast.
There you go.
It's not even really, it's a little bit of a out of the box thinking out a question. As a person that's also responsible for protecting the data for my organization, I did have a little aha moment sometime last year that between consumer products that people are voluntarily sending in their data and the fifth letter I got in the mail of, oops, sorry, we let your data go. Is data getting devalued anyway? Because I feel like it's been spread and leaked so many times. Do you ever feel like it, that there's just a devaluation of data, which might work in our favor at some point? But I was just curious if you've ever thought about that.
I think yes. I think the younger folks don't even believe they have any data privacy or data protection because that's just the way that they've lived. Gen Xers, at least like me, we pretend like we have data privacy, but I've had security clearance in the past, and we had an OPM, which is the Office of Personnel Management breach back in 2008 or 9. And if OPM in a security clearance database can be breached and all of my data is out anyway, I don't know what I'm hoping to protect. And to her point, which is biopharma and others, you care a lot about at least the topic of patient privacy, patient security, but patient privacy and data security is at odds with collaboration and research, et cetera. So it's a lot of yammering that we do about it, but it's not real, right? I mean, that's my view. Please chime in, and then we can eat and talk about it some more. Anything you guys want to say? It's always practical. So.
Yeah, so again, human-assisted creatures, don't go crazy, at least in 2026. Look at all your contracts and question 100 times the business leaders, why do you need this? Is it going to improve survival? Is it going to improve efficiency? Is it going to have less pain? You don't need Tylenol for that pain. So ask as many as questions you can. But again, have a calculated risk and deploy these if you want to become more efficient and safer.
Fantastic advice. Big round of applause for the panel.